The views, opinions, and presentations of the guest are not intended to establish a standard of care to be followed by the audience. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding your health. Furthermore, the assumptions, views, opinions, and insinuations made by the host and guest do not reflect those of the show and the management. Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.
Hello and good afternoon, everyone. Thank you and welcome to our episode of Health Talk, your source of good health, good talk, health talk. And today we're going to discuss about maintaining a healthy weight during quarantine. So I know for a fact that this is a very interesting and at the same time very sensitive topic. Kasi syempre, it has been 4 months already that we are on quarantine. And when we talk about quarantine, it's about being at home, inside our very home. So syempre, nandyan yung mga araw-araw na luto ni mother or ni Mrs. or ni Mr. din. So talagang napakasarap kumain, especially when you are with your family. But what we are currently doing is actually we are compromising some of our health assets such as our weight. So therefore, lahat tayo nag-iisip, paano ba tayo makakabalik alindog? 'Di ba? Yun ang sinasabi natin lagi. So to help us tackle about obesity, what is obesity, and probably what is the best diet that we could do as an individual, we have with us our lifestyle and obesity medicine doctor to talk further about this matter. So please welcome our doctor speaker for today. Our doctor speaker is a graduate of medicine at the University of Santo Tomas, a diplomate of Philippine College of Lifestyle Medicine, and diplomate of International Board of Lifestyle Medicine. Dr. Speaker is also a graduate of MBA in Health at the Ateneo de Manila University. Dr. Speaker holds specialist certification of obesity, professional education in World Obesity Federation, and Blackburn course in obesity medicine at the Harvard School, Boston, USA. So without further ado, let's welcome our Dr. Speaker for this afternoon, lifestyle and obesity medicine doctor, Dr. John Paulo Di Pasupil.
Hi, thank you, Aga, for that kind introduction. I'm so sorry. I know that a lot of you have eaten now, maybe a healthy one, or maybe somewhat kind of fatty, or let's say the buffet. But I'm just going to talk to you how you could start, or maybe how you could maintain a healthy weight during quarantine. So let's start this very important topic: how to maintain a healthy weight during quarantine. Hold on. So before that, there are housekeeping rules. You could use the chat to post comments and questions if preferred. There will be a chance to ask questions after the presentation. So on this webinar or this talk, we'll be offering you some practical strategies to guide you to healthier lives and healthy weight. And this education would be covering obesity overview, its bad effects, some healthy lifestyle plans such as the nutrition, physical activity, and good healthy habits to effect healthier changes. So I think you know this person. She is a singer and she's been struggling her weight for a couple of years already. And then during the quarantine season, yan, medyo pumayat na po siya. No? Laki po yung nabawas po niya. Her name is Adele. So, naririnig niyo po yung mga kanta po niya, lagi-lagi po. So, ang laki na po yung napayat po niya. And here in the Philippines, we have Corina Sanchez. So, laki rin po ang pinayat niya during the quarantine. She did a lot of dieting and, of course, a lot of exercises. And you could see from her Instagram account that there are a lot of swimming activities. So, what is obesity? Hindi ko po to talk about po ang abs o paano maging very, very sexy. We'll just talk about what is obesity first, no? So, obesity came from the Latin word obesitas, that means fatness. So, it is now classified as a disease by the American Medical Association and the World Obesity Federation. So, it is a chronic relapsing disease characterized as excessive accumulation of adipose tissue that is sufficient magnitude to impair health. Now, in the Southeast Asia, Malaysia leads the count, that is 44.2%, and then Thailand, that is 32.2%, Singapore, 30.2%, and in the Philippines, that is 26.5% of overweight and obesity. So we are in the fourth, and then this is 2011, and we're still waiting for the latest updates on the statistics of the prevalence of obesity. Now, ang akala po natin, it's more on the mental or discipline po ang obesity o pag-increase ng timbang. But there are also medical conditions that could contribute to the weight gain. Here are some examples like sa thyroid problems, pwede din sa endocrine like sa Cushing disease, acromegaly, or it could be sa OB-GYN naman na polycystic ovarian syndrome for. And then there could be some medications that or mga gamot na iniinom nyo that could cause weight gain. Now, there are four M's or four bad effects that would drive. There could be a complication, there could be a barrier to weight loss. So, first M is mental. So, akala po natin is hindi walang ganong relation ang obesity sa mental. It could be both. It could be vice versa, no? Mental, it could be depression. Yung mga iba kasi nahihirapan sila magpapayat. It could lead to depression or it could be meron silang na-experience, especially during this quarantine season, mas lalo sila na-overeat kaya tumataba o tumataas ang timbang po nila. Another is the addiction. Could be psychosis, some eating disorders. These eating disorders could be overeating that we could somehow be eating, let's say, some midnight snack or sa mga kumakain tayo sa buffet, or maybe some trauma and insomnia. The second M is the mechanical. So, it could be sleep apnea. Ito po yung may related po sa obesity. So, kung malaki-laki po ang katawan, you're more likely to have this condition, yung sleep apnea na mga within 10 seconds to 30 seconds, hindi po kayo nakakahinga when you're asleep. So, you need to see a doctor right away. Baka hindi po kayo makapag-function sa work nyo because antukin po kayo. It could be also some chronic back pain or other chronic pains of your muscles, reflux disease, ito yung GERD na tinatawag yung parang dighay ng dighay, osteoarthritis. Kung sa mga matatanda, hirap po sila laging kung naglalakad pa lang po, sumasakit na agad yung mga binti po nila or makasukasuan. And then it could be some incontinence and then thrombosis or sa mga blood vessels. And the third M is the metabolic. So halos alam na po ito, type 2 diabetes, no? Dyslipidemia, ito yung mataas ang cholesterol. Kung lagi kumakain na matataba o hilig niyo po ang mga fast food chains, yan, fast food meals, yan po. Pwede magtaas. Hypertension, gout, fatty liver, gallstones, kasama po yan. Yung PCOS na sa babae, and some forms of cancer. And then the fourth M, ito monetary. Some of the individuals, kung nakita po nila na malaki po ang katawan, ay baka hindi po siya makapag-function. For example, baka sa motor, sa sobrang laki, baka hindi maka-travel right away o makapaglakad ng maganda or makapag-deliver ng specific task. So it could affect then yung work po nila. Now, when we discuss about obesity, we don't just go for abs, we don't go for just aesthetics, we go for health benefits. So kung may kami nakitang patients with overweight or obesity, we would like to improve yung patient health, no? And then improve the quality of life. And dun naman sa loob, improve the body weight and composition just to prevent them from other comorbidities like yung mga type 2 diabetes and hypertension and so on. No? Now, there are three main indicators when we talk about obesity or overweight. Well, we use this body mass index. It's the most common anthropometric weight tool. It is correlated with metabolic conditions. I'll be discussing that for you to know kung paano mo ba mag-compute ng body mass index. And then the second one is the body fat percentage. So ito gumagamit kami ng smart weighing scale. If that's for men, that's 25% or more or 32% or more for women. Yan po ay classified na po as overweight and obesity. Now, if you don't have a smart weighing scale, you could use a tape measure so you get the waist circumference po, no? And if it's 90 centimeter or more or for Asian men and 80 centimeter or more for Asian women, yan po ay classified as overweight and obesity na po, okay? Now, dun sa BMI o yung body mass index classification, I think you have heard of this one when you are going to the clinics and maybe for your annual checkups. We have the two types, the WHO, the World Health Organization classification. This is for Caucasians and Africans and other ethnicities. Now, another is the Asia Pacific po. This is for Asians. So for underweight, 18.5 pareho, but for normal, that is 18.5 to 24.9 for WHO. And then for Asia Pacific, it's 18.5 to 23. So mababa. The reason why na binaba po nila is because we Asians have higher risk for diabetes and other metabolic diseases. And that's why the overweight, yan na po, 23 to 24.9. Tapos yung obese na po medyo mataas na, 25 to 29, and yan, tumataas yung classification. So paano po ba mag-compute nitong BMI classification? Baka within na normal na ba ako? Overweight or obese? So ganito po mag-compute po ng body mass index. You just need to know your weight in kilograms and then height in meters squared. Or I mean in meters, no? So, for example, you are Juan de la Cruz. Your height is 5'3", and you weigh 176 pounds. So, compute nyo lang po yan. Get the 80 kilograms divided by 1.6 divided by 1.6 if you have a calculator. And if not, you could use Google. Madali lang mag-Google po, no? Just type body mass index calculator, or there are other apps that you could download and use. Lagay nyo lang input nyo lang po ang weight and your height and you will get this BMI. If for this, ano po ba ang classification po niya? 31.2. So mataas na po yan. Nasa obese class 2 na po siya. So we have to do something about that. No? So paano po ba? Ano bang stages of weight management? Kailangan ba agad mag-diet and exercise na po ba? O mag-bariatric surgery? Inom na ba ng gamot? Of course, start muna tayo sa lowest o yung first step, no? Universal intervention. Ito ay yung ginagawa ay prevent and reinforce healthy eating and physical activity messages. So, kung naririnig niyo sa mga news like the Department of Health, na you have to include healthy vegetables, healthy fruits, and then you have to engage in physical activity. Those are the core components of weight management. If not, hindi po nag-work, that's the time that you will be going for the intensive lifestyle intervention. You'll be identifying and magkakaroon ng primary assessment. Baka ito na po ay meron na po mga conditions na nagko-cause ng weight gain. Yung nasabi ko kanina, yung mga medical diseases, or it could be the medications that be causing that. There are also supplements that may cause weight gain. No? So just to remind you, na you have to look at the nutrition labels and even the ingredients of the particular supplement and the medication. If hindi nag-work po siya in 3 months, that's the time that you'll be that your doctor would be giving you a medication for anti-obesity. So yan, magbibigay po ng mga special weight management program for you. If that didn't work or parang nag-work but to slow lang yung progress, that's the time that the doctor would be recommending a surgeon for a bariatric surgery. Okay? So we'll be focusing on the lifestyle interventions during quarantine. So we have three things that you have to remember: nutrition, physical activity, and behavior. Okay? So you still have to take some medications, oh, yung mga prescribed ng doctor sa inyo. You still have to take it, no? Do not stop it because na nawala or di nyo makontak or any kind of reason. Please get in touch with your doctor right away, okay? So let's start with the nutrition. So sa nutrition, ang importante ay you have to reduce your calorie intake. And here, meron mga calorie reading tayong ginagawa. But of course, minsan sa pag-calorie counting, merong mga bagay-bagay o mga foods na calories in ay hindi po equivalent to calories out. Okay? So, we still have to see kung ano po ba the best diet po ba. Ano ba yung the best diet na dito sa atin o sa inyo na pwede nyo ma-apply? Okay? Ito po ba ay water therapy? Ito po ba ay ketogenic diet? Ito po ba ay yung mga no-rice diet, DASH diet, intermittent fasting, Atkins, flexitarian, plant-based diet, vegan diet, o baka itong bago ay K-pop diet? Kung K-pop at mga iba kinikilig na po dito. Now, the best diet, wala pa rin consensus, but most of the professionals would agree this advice, no? Kailangan personalized pa rin po siya because no one diet does not fit all. You still have to decrease the intake of sugar-rich soft drinks. That includes your milk tea, no? Yung mga may hilig mag-milk tea, kasama po yan. And then you have to decrease your energy-dense fast foods. Ito yung mga high-fat, starchy carbs with low fiber, whole grains. Kailangan po i-check po yan, no? And then increase your nutrient-dense foods with moderate in fat, higher in protein, fiber, and whole grains. So kung sinabing energy-dense fast foods, ito po yung mga fried chicken, mga French fries. So kung i-compare nyo ang fried chicken sa roasted, ay malaki po ang calories po niya. So ang fried chicken po ay nasa approximately 390 calories. Ang roasted naman po ay nasa 190 calories. Kaya ano po ang gagawin? Fried na po ba or roasted? Now, sa physical activity naman po, ay akala po natin ay kailangan mag-exercise. Exercise lagi iniisip. Well, there are two different, may different po ang definition of physical activity and exercise. Physical activity is any bodily movement produced by your skeletal muscle to result for expenditure or para matanggal o magamit mo yung calories, okay? And then yung exercise naman is planned, structured, and repetitive body movement done to improve or maintain fitness. So, in other words, ang exercise is a subcomponent of physical activity. Itong exercise, ito yung mga ito yung mga sit-ups, ito yung mga push-ups, but ang physical activity, anything like moving or mag-walking, mag-gardening, and so on. Maski nagti-TikTok po kayo, that's okay. Now, we have two different kinds or types of physical activity. We have the moderate physical activity and the vigorous physical activity. But first, I'll be discussing to you the moderate physical activity. The recommendation of the American College of Sports Medicine is 150 minutes per week. if we're going to break it down in 1 week, siguro 30 minutes in a day, 5 days in a week. So Monday, Tuesday, Wednesday, Thursday, Friday. Okay na po yan. But if not, you're quite busy, hindi nyo kayang tuloy-tuloy po yun, that's okay. You could do Monday, Tuesday, tapos break nyo Wednesday, Thursday, Friday, and then Saturday, another 30 minutes. Okay? Here are some examples that you could do. So, walk briskly, doing some household chores. So, sa mga bata po o mga kabataan, tulungan nyo na po sila nanay o mga parents nyo. It's one form of the physical activity. And then umuuso ngayon during quarantine is yung cycling, no? May nagba-bicycle, and then the government is really supportive on this program. Iba naman yung ballroom dancing, fishing, may golfing and yoga. Others may swimming, uh, tennis, table tennis, and badminton. But of course, if it's not available or it's still restricted, huwag niyong pilitin kung ano pong available na physical activity that you can do at home. Try to push it. Another is your vigorous physical activity. Kung bored kayo sa mga moderate physical activity, you could do this, especially if you are quite stressed and kulang ang oras nyo lagi sa physical activity. Yun yung mga number one reason why they can engage with physical activity is yung kulang sa time, laging busy. So this is good for some of the people, general population. But if you have some physical or medical conditions, especially in your heart, we advise you not to engage with this vigorous physical activity right away. We advise you to go or consult with a doctor before you engage with vigorous physical activity. Lalo na sa mga walang physical activity, tas biglaan po nag-golf, biglaan po nag-jogging, nag-walking, nag-running sa mainit na panahon, ay baka pwede kayo ma-heat stroke or magkaroon ng stroke or heart attack. So we don't want that kind of things to happen. So, but in the general population, ito po mga examples. And then a recommendation is 75 minutes per week. So if you're very busy, you could do it on Saturday and Sunday. No? Pwedeng hatiin po yan. So race walking, jogging, running, Zumba, yung aerobic dancing, kasama po yan. Cycling, yung mga mabibilis na tumatakbo, yung mga, yung padjak po nila. Boxing is part of that. Tennis, singles, jumping rope, hiking, and volleyball. And now I know you're having hard time going out because of the quarantine restrictions. So we have some home recommendations that you could do. So it is easy to follow. There's no special equipment, and then it requires limited space. So just remember SWOT. So SWOT means S is stand up. Reduce your sedentary time by standing up whenever possible. So ideally, aim to interrupt sitting and reading time every 30 minutes. Okay? So mga nag-work from home, please do this mga every 30 minutes. Kasi malamang mga ibang tao, you are just stuck in your computer, your laptops, nakaupo, madalas you're trying to you're trying to beat your deadline. So try to stand up and to every 30 minutes. Next is walking. So walk around or walk on the spot, even if you have a phone call or may kayong kausap or you're using your cell phone, please walk while you speak, because when you're just standing up or walking, you could somehow increase your calorie expenditure from 100 to 200 calories per day. So malaking bagay na po yan, no? And then the next is online exercise. So we have to take advantage of the wealth of online exercises. Many of these are free and can be found on YouTube. Wag kayo pong masyado sa Netflix, but you could search on the YouTube for more of the fitness and other exercises that are available. And then T is take short breaks or short bouts of physical activity, add up to weekly recommendations like dancing, playing with your children, yung mga apo niyo po, pwede po yan, no? And performing domestic chores. So staying at home for prolonged periods of time can pose a significant challenge for physical activity. So for self quarantine can cause additional stress and challenge the mental health. And physical activity can be a valuable tool to help you remain calm. So that means it could also help you in your emotional and mental health. So physical activities has three things that could benefit you: physical, emotional, and mental health. Okay. Now, here are some healthy tips ng, according to a study in the US, they call it the National Weight Control Registry. Ito po ay nakapag-lose ng 30 pounds and they were able to keep up for almost 2 years. Here is their secret. No? So they eat breakfast every day. They don't skip breakfast. They don't skip it. So 78% po yan. Ang rule namin dito is have a regular eating pattern. No? And then the second one is they weigh themselves once a week or maybe once a day. No, this one is self-monitoring. So you are very much more conscious with what you are doing. It makes you more aware of your actions, especially what you're eating. So that's a good healthy tip and a weight loss tip if you wanted to continue with that. Next is you have to lessen your sedentary time. That is to watch less than 10 hours of TV per week. So yung mga nag-Netflix, bawas-bawasan niyo po. Huwag kayong sosobrahan po ng madaling araw kasi if you are a late sleeper and even if you sleep less than 6 hours or more than 9 hours, it would definitely increase your weight. Okay? And then, itong pinakamataas, 90% of the participants, they exercise about an hour a day. So, malaki pong bagay po ang 1 hour per day. And then the pinakamataas is 94%, they increase their physical activity by walking. So, wag nyo mamaliitin po ang walking. Maski nasa bahay po kayo, lakad kayo ng lakad, akit sa taas, sa baba, you're just climbing the stairs, okay lang po yan. Okay? So, in summary, we were able to discuss obesity, which is a rising burden in the world, even in the COVID 19. It is considered to be the second biggest risk factor for COVID 19 risk as for severe illness. And then it is defined as a chronic relapsing disease characterized as excessive accumulation of adipose tissue that is sufficient magnitude to impair health. Now, sa mga nagbabalak po mag-lose ng weight, you need to start doing it. No, start somewhere. Do not think of ideal weight program. Wala pong ideal weight program. It is you who could just start. So you could just start with your nutrition or your diet muna, and then you move towards your physical activity kung type nyo pa or feel nyo na i-combine yung dalawa. And then you mind also your sleep and then your hydration. Okay? Focus on your strengths and remember three pillars of weight loss: healthy eating, movement, and good behaviors. If you're uncertain and you're taking some medications and you feel that you're you are significantly lost a lot, or you have made a portion sizing and then you're still gaining weight, I think you should consult a doctor for you to get a good management, and then they will guide you. Okay. So if you have any questions, siguro mga iba nahihiya, just feel free to send me a message at my Facebook page at Dr. Jan Di Pasupil. Okay. I'm also affiliated with the Providence Hospital and Healthway Medical. So that ends my presentation. I'll be going back or switch the board to Aga.
All right. Thank you very much, Doctor, for that very informative discussions about healthy weight during quarantine. So I'm pretty sure, Doc, na maraming natuto or natuwa and sometimes siguro napangiti with your discussions kasi there are many interesting highlights on your discussion. So great job and thank you for that. And now we are going to entertain questions from our Facebook Live viewers. They are over 100 of them. So welcome guys to our Health Talk episode for today on FB Live. Magandang hapon po sa inyong lahat. Thank you once again for joining us in today's episode of Health Talk. Now going back, Doctor, on your topic, I have a few questions before we entertain our live viewers. So first question, Doctor. On your slide, you mentioned about obesity. We were talking about a topic to put as a header on this discussion, obesity. But you said that let's not put that because it might put or create a little bit of sort of insecurity or not that good to hear sa mga ibang tao. So, but in your first slide, you mentioned that obesity is, if I correct me if I'm wrong, it's equivalent to
Yeah.
fatness. So, what can you say about that?
Okay. Obesity came from the Latin word obesitas, that means fatness. So before, akala po natin kung malaki po ay something healthy. Dun po parang busog-lusog ang iniisip po nila. But when they found out na parang mas maraming nagkakasakit, mas may mga diabetes. Actually, there's a study that almost 90% of overweight or 90%, meron pong overweight and obesity, meron din pong diabetes din po, no? So, kung nagkakaroon ng significant impairment of your health, that is something that you have to mind and take a look at your health. So now the American Medical Association and the World Health Obesity Federation classified obesity as a disease. So chronic, ibig sabihin matagalan, relapsing, pwedeng pabalik-balik. Kaya meron po tinatawag na weight cycling, no? Akyat, baba, akyat, baba. So it's really a journey. And then there are multiple factors, not only mental health. Yung nasabi ko kanina, it could be some physical, it could be your medical conditions, even the supplements that you're taking. Aging is also part of it, and genetics also has a role on that.
Mhm. Thank you for that answer, Doc. Now, you mentioned about the different bad effects of obesity. So siguro just for the information of those who just joined us, can you just please repeat, Doctor, some of these four key bad effects that you mentioned of
Yeah.
obesity?
So ito po mental problems. So depression, yung mga anxiety, overeating, kasama na po yan. The second M is mechanical, yun yung mga sleep apnea, hirap matulog, gout, tapos yung reflux, kasama po yan. Yung GERD, yan, yung madalas yung dighay ng dighay. We have the third M, which is metabolic. So ito yung metabolic, yan yung makaramihan yung kasama yung type 2 diabetes, hypertension, non-fatty liver diseases, PCOS o polycystic ovarian syndrome sa mga babae, and even some forms of cancer. And then the last M is money. So that kasama ng education, kasama ng employment po doon, even the insurance nasasama din po doon. So it has a factor, no? It's not only health. It's also a holistic yung approach din po ng weight management.
Yeah, all right. So those four bad effects: mental, mechanical, metabolic, and monetary. Pwede
Yes.
ba to Doc, like which one is more, prevalent to your patients, at least to your clinical experience?
More on the metabolic po ang nagkakaroon ng uh, nare-report po nila.
All right. All right, Doc. So there are some questions already coming in. So for those of you who are interested to learn more about gaining a healthy weight, and at the same time, obesity and some of the risk factors of obesity, please ask your question on our FB Live, and our doctor speaker will be more than willing to answer those questions, di ba, Doc? But before that, I have one last question po, Doc, before we entertain them. Um, you mentioned about BMI, which is the body mass index, right? Body mass index. And there's a comparison also when it comes to standard from Asian versus Western. Yeah. So what again is the normal BMI and why is it different? Why is Asian body different to Western?
Okay. Yeah, we have BMI is called the body mass index. Sa mga nahuli po, hindi po nila naabutan yung first slide or yung mga first few slide. Body mass index, we use yung height and then your weight. So kung gagamitin niyo yung formula is kilograms divided by meter squared. So kung gagamitin nyo is kilograms divided by meters divided by meters po ulit yun. Or if you're using calculator, but if medyo nagugulan, hindi kayo ganong into math, just Google nyo na lang, BMI calculator, makikita nyo agad. Just input your weight and your height. And they may require your age just to see that. The normal BMI for Asia Pacific is 18.5 to 23. Why is it it's lower than the WHO o yung mga Caucasians, mga white, yung mga Africans, and other ethnicities? Because Asians have higher risk of metabolic diseases and then higher percentage of body fat. So binawasan po yung classifications for Asians. That is the main reason why they have reduced that. And then this is used for the general population. Mga iba siguro nagtataka, ay ginagamit pala ni Doc itong BMI, pero maskulado naman po ako at atleta po ako. Bakit BMI ko is more than nasa 26 o 28? Eh, healthy naman ako, may abs naman ako. Well, if you're muscular and athletic, you don't use BMI kasi magkakaroon ng false positive. So, yun, nakita nyo, nagkaroon ng example ko, musculado tapos obesity yung result niya, no? Because muscular po siya, we don't use that. We use other measuring or anthropometric tools. So, we use body fat percentage, a smart weighing scale, or a tape measure. So, we still use the tape measure. It's a very simple tool for us to know. So 90 centimeters naman po for men if it's more than that. If it's more than 80 centimeters for women, yun sa overweight ko ng BCP classification na po.
All right, thank you, Doctor, for clarifying that regarding BMI. Now, let me entertain some of the questions, Doc, from our live audience. Dumadami po sila, Doc. No? So let's start with the question coming from Ms. Charmin Gay Kilip. And she's asking about the medications. What are these medications that can cause overweight or obesity?
Okay.
Any of those that you have in mind now, right now?
All right, there are a lot of medications that may increase the weight, but just to give you an example of the weight that the medication could be yung mga antipsychiatric medications, and then yung mga steroids. We have to be very careful than that. That's why doctors just prescribe a medication or steroids for a short period of time, and then you will be seeing na medyo lumalaki na po yan. Lumalaki po yung katawan niyo because of that. There are also medications that may increase like anti-hypertension o pagbaba ng blood pressure. May ibang medications po yan. Meron din pong mga anti-diabetics. Even yung mga mga allergic rhinitis, yung mga antihistamines po natin. Meron pong yung mga first generation po na antihistamines. I won't be saying po ano mga generic medications, but it's important then that you have to consult your doctor if they feel na parang ay mukhang lumalaki nga po kayo, baka we have to taper it or baka slowly we're going to babaan po natin yun.
All right. So I hope na-address yung tanong ni Ma'am Charmaine Kilip. Now we have another question from AD, and she's asking, what is the recommended caloric intake a day?
It would depend of a person's body weight, so and then the age. We use yung Mifflin St. George equation, or if not, you could just search out the internet for yung mga tools. But in my practice, a rule of thumb lang po to ha. If your weight is 150 pounds, so times 10 nyo lang po yan, that is 1,500. Tama po ba?
Mm.
Tama ba, Aga?
Yeah.
So that is the minimum weight, minimum calories that you would be taking for you to maintain your weight. Okay.
Mm.
If you're not moving, if you're just at home, but if you have some physical activity pa, like you're in a minimal to moderate or vigorous, magtataas pa po yan. No? So I could guide you with your eating ano naman and your calories depending on your physical activity din po. Because when we do that too, we also check your physical activity and even your sleep. Kung konti lang yung tulog nyo, baka minsan yung konting kinakain nyo, medyo sluggish din po ang metabolism nyo. Kaya minsan nakaka-experience din po kayo, sakto lang yung pagkain nyo. Wala kayong pinagbago itong quarantine, pero bakit tumataas ang timbang? So, it could be possible na dun sa physical activity bumaba. Nandun na lagi tayo sa bahay, hindi tayo masyado nag-walk, kaya yung metabolism din natin na-affect din po siya. Okay? So, dun sa slide ko kanina, it could be yung calories in and calories out. We have to balance it then, no? Especially with our present situation.
Yeah, kaya importante rin na gawin yung SWOT, Doktor, no? Yung suggestion mo. Which is a
Yes.
very creative concept, sabi ni Dr. Hardik kanina.
Oh,
The
thank you.
SWOT concept going into home quarantine. Yeah. And Doc, we have another question from Mary Ann Sanchez, and she's asking if can hormonal imbalance be a cause of obesity?
Yes, pwede po yan. Pwede, it could cause yung pag-increase ng timbang. That's why your doctor would guide you with your eating then and then your medications. But first, they have to solve your hormonal imbalances before anything else because yun yung isang cause din po na nagtataas ng timbang. So they have to check or need to know the root cause. Then we move towards other things. Okay.
Yeah, all right. So I think more women are asking, Doctor, no, with regards to obesity, they are very much concerned. And now we have another question from related to women health again, and this is coming from Annalisa Jamili, and she's asking Doc if what are the health effects for women who are who are at an unhealthy weight?
Health effects of
Yeah,
who have
for
unhealthy.
women who, yes, who has unhealthy weight. So
Okay.
maliban po doon sa nabanggit ko kanina regarding the PCOS or what
Yes.
else, Doc?
So yun meron there could be dun sa hormonal imbalances. There could be some problems with uh, their menstrual cycle, no? It could affect din po yan. And isa na po yun yung baka may hirapan din sila sa reproductive yung kanilang gusto nilang mga anak, no? So it could significantly affect din po yung chances po nila. That's why your OB/GYN is also telling you to have a healthy weight. Not only if you're planning to get pregnant, no? During the pregnancy, it's also important na healthy din po kayo because pwede rin magkaroon ng diabetes. We call it the gestational diabetes. The next, after mapanganak nyo naman po, kung malaki pa rin naman po kayo, you could also have diabetes after the pregnancy. And you could also cause maliit po yung bata o medyo malaki din yung yung baby niyo po, yung infant niyo po. And then there are studies kung may effect kung medyo malaki yung katawan niyo po during pregnancy and then after 20 years, yung bata ay pwede rin po tumaba. So we don't want that kind of yung result po na nangyayari kung ganun po yung kung mataba ang nanay tas medyo tumataba din yung bata. We don't want that to happen. So if you want to plan a family, you also have to plan or think about your health, think about your weight, no? Don't just think of it as gusto ko lang magkaroon ng abs, gusto ko lang to make myself maganda yung figure. No, it's you have to improve your health, the overall quality of life. Okay.
And all right. Thank you, Doctor, for that clarification. Now we have another question regarding thyroid, and this is coming from Angie Dishon. Can you still lose weight with an underactive thyroid?
Yes, you can still lose weight. Your doctor, you still have to consult a doctor there. Kung kulang po yung thyroid, yung levels, your doctor would be giving you a medicine for that to supplement yung kulang. So, and then your doctor would also be telling you what are the foods that you need to take for you to maintain a healthy weight and it won't affect to the thyroid levels. Okay? So you have to listen to your doctor sa pagsasabi niya pa lang po dun sa pag-intake na medication. Kung sinabi niya morning, you need to take it early morning, take it po. Huwag niyo pong sasabihin, ay mas gusto ko po siya after ng gantong breakfast. Huwag niyo unahan. You still, there's a science behind that, okay? And then kung meron siyang sinabing, please don't eat this one because meron din pong effect. Your food is a medicine. So kung food is medicine, very powerful din po siya. Okay? So please listen to your doctors, especially these times. Okay?
And thank you for clarifying that, Doc. Now we have another question from Mr. Emmanuel Sakai, and he's asking about TER. If you're familiar with it, Doc, TER. Any recommendation for an obese person?
Yeah. Well, the total energy requirement, yung nasabi ko kanina we use the Mifflin St. John equation. You could just check it out. Medyo techy po lang yung madaming mathematical equations po kaming ginagawa for that. But a rule of thumb for the viewers, that's a Facebook page, we use the rule of thumb na kunwari 150 pounds or 200 pounds po kayo, times 10 niyo po yan, that is the minimum way for you to maintain your weight. Now, if you are going to lose, arithmetic po ito ha, if you're going to lose 1 pound, we subtract 500 calories in your from the 2,000, so maging 1,500 po yan in a day. So for 7 days. So you'll be expecting po yan just for calculation and mathematical calculation na mag-lose po kayo ng 1 pound in a week. But if you are going for lower than that, gusto nyo talagang habulin na merong let's say kasal o parang may special event o baka gusto niya talagang ibaba lang yung timbang because for health reason, we have up to 2 pounds per week. So kung up to 2 pounds, less nyo 1,000 po yan. So from 2,000 minus 1,000, magiging 1,000 calories na lang po per day for 7 days. And then you're expecting 2 pounds weight loss po. So that is mathematical calculation. But in reality po to it doesn't give you that result. Okay? It doesn't give you the result because we have different, nasabi ko kanina, we have multiple factors affecting your weight. Okay? In the first week, just to tell you, and also based on the practice, and I think, alam ko, ganito rin nangyayari sa mga artista at nasubukan nyo na po, the first week, sasabihin nyo 3 pounds or more than a lot of, or 5 pounds and na-lose nyo per week for the first week or first 3 days. It's because of the food na tinanggal nyo. It's also the water intake na natanggal nyo. So not necessarily lahat taba po ang tinanggal nyo. It could be the food na kinain nyo the past 2 or yesterday or the past 2 days. So talagang nagbawas talaga kayo nagtimbang. Parang kayo nag-cleansing. Kaya huwag kayo magugulat po after 2 weeks, naging sluggish na po yung timbang nyo. Okay?
Ayan. Thank you, Doctor, for your answers. Now, let's go to diet. I'm pretty sure ito talaga yung inaantay ng karamihan. Talk
Mhm.
about diet, no? So we have a question here from Randy, Dr. Randy Evelyn Venus, and the question is, can you further elaborate the different diets like keto diet you mentioned, and any comment or maybe differentiation uh, from each of these diet, if you may, Doc?
Oh,
Siguro
okay.
let's start with keto diet kasi yun yung gusto talagang tanongin ni Dr.
Ah,
Venus.
oh yeah, yeah. Actually, madami talagang diets out there. And I don't have the luxury of time to talk about yung dami po nun because I was
Yeah,
given
yeah.
30 minutes. But for you to know ketogenic diet or keto diet, it is a very low calorie diet, no? So, nasabi ko kanina, reduced calorie intake, so very low calorie diet that is less than 800 calories or 800 calories dapat po per day ang nakakain niyo po. And then, ang type ko naman nitong ketogenic diet, and alam niyo na naman po ito kasi nagbabasa po kayo. It's a very low carb diet. That means, kung mga hindi pa nakakaalam naman, parang wala po kayong gano'ng kakain na carbohydrates. Could be rice, it could be wheat bread, and or bread or anything na carbs. So if we're going to example lang, it's less than 1 cup per day lang ang pwede nyo makain. Parang ganun lang yung limit po ng ketogenic diet. And ito po ay kailangan nyo pong talagang maging consistent, no? So we tell them to stick to it, but this is only for short-term management, okay? Short-term, that means three months lang po yan. If you go beyond than that, baka there would be some malnutrition or deficiencies dan sa vitamins and minerals po. So, mga iba magkakaroon ng brain fog, magkakaroon ng mental confusion, madaling mainis. Mga iba naman po ay nagkakaroon ng hair loss. So, please lang po, before you initiate any kind of diet, especially if you have medical conditions, consult a doctor or healthcare professionals para lang for your weight, no? And then do not take any supplements that are
Yeah, yeah.
not endorsed or maybe approved by FDA, no? Yung
Mm-mm.
mga nabibili sa market na dahil could be networking or from other countries, please check the labels if they are FDA approved. Okay?
Yeah. Actually, buti nabanggit mo yung Doc no, regarding sa diet pills. That's a question from Junie Marshall. So, you answered already about diet pills. How about diet drinks? Ang dami din kasi ng doctor, just go to, this convenience store, supermarket, grocery. Ang daming diet pills even in commercial. So, how
Uh,
about that, Doc?
just to give you an example, there are anti-obesity medications that are available here in the Philippines that I prescribe for my patients. Just the diet pills na nasasabi ko lang po is the one that are not FDA approved. Now, there are also diet drinks out there. Just a caution for you and healthy tip po, no? Look at the label. If they are rich in carbs, o mataas yung sugar component po nila, and then you keep on drinking that for, let's say, a month na, and no changes with your weight, better to change it or think about it. Baka yung isa nagkakos ng pagtaas ng timbang. Kasi
Mm.
some of the meal replacement, some of us, we use drinks or diet drinks as a meal replacement. Pero kung biglang nagutom ka, gagawin mo na siyang naging 2 meals na po yan in just one, no? So, yun yung nangyayari sa iba. Bibili ng meal replacement, tapos kakain po sa fast food, di dalawa na po yung meals nyo imbis na isa. So be careful on choosing some of the diet drinks in the market.
And all right, thank you, Doc. And we are down to our last three questions, Doc. So hope you can
Oh,
still
sure, sure.
accommodate these questions. Very interesting yung K-pop diet.
Oh, yeah.
I'm pretty sure lahat on K-pop ngayon, lalo ng quarantine. Pero K-pop drama, K-pop songs, and the artists themselves, no. So, what is K-pop diet?
Oh, I think konti pala ata nakakaalam nito.
Mm.
The K-pop diet yung ginagawa ng mga celebrities from Korea. What they do is a plant-based. So kung plant-based, um, kain sila ng mga kimchi, and then there are more on the vegetables and apple or fruits po in the morning. So kakain talaga sila noon in the morning, tapos yung kanilang lunch, ganun pa rin po. And konti lang yung meat, o minsan wala silang meat na kinakain. Hindi katulad sa mga samgyeopsal na here in the Philippines, na madalas kinakain natin yung karne. So sa kanila naman, konting-konti o baka wala pong karne ang kinakain po nila. Puro gulay po yan. Like the appetizers that they serve here in the Philippines. Yun yung kanilang meal na po. Okay? And then their special kind of snack is sweet potato. Mas preferred nila ang sweet potato as their snack. They boil it. Hindi nila ginagawa ang kamote cube na parang sa atin aga. So their choices and their cooking style, more on the fermented and less of the deep fried. So remember, limit I think may nakita kanina, limit yung mga deep fried foods. Tama po kayo, limit yung mga deep fried foods. Better you go for healthy cooking style, the roasted and then the steamed and boiled, yung mga, and other soup-based kind of foods. Okay?
Ayan. So, follow-up question, Doctor, regarding K-pop diet naman. Kasi syempre K-pop, samgyeopsal. Everywhere, in the corner. Di ba? Samgyeopsal yung, the invasion, Korean invasion as they say, di ba? Andyan lahat. So, we talk about buffet, not just samgyeopsal, but buffet in general. Sige, I'll eat a lot, but then I can burn it naman eh. So that's a question from Jason. Tinatanong niya, if can I just eat and then burn it later on?
Yeah, you could still eat, no? Wala naman nagsasabi you would be restricting that or you won't be eating that for the rest of your life, no? You just have a choice. So may choice naman po kayo. If you're going to take it in moderation, or if you're going to take it more than that, nasa inyo po yan. No? We call it the mindful eating principle. You're be mindful and be aware of what you're eating. For example, kakain kayo ng sweet or itong, for example, itong samgyeopsal, yung puro karne. Are you going to eat it mga 5 or 10 pieces? And you know that you have heart condition, or you are aware that you want to lose weight, baka gawin nyo na lang po munang 8 o 5 muna na pagbawas. Of course, you're in a samgyeopsal buffet. You have paid your money's worth, right? You get your money's worth. Susulitin nyo po yan. And I know a lot of you would like to do that, no? Susulitin nyo, you will get the best and then the expensive kind of food para lang masulit ang kinain. But of course, you have to balance it out, no? You have to check then also your health. So, imbis na 10 dati, gawin nyo na pong bawasan nyo ng 8 or maybe 7. Tapos, dagdagan nyo na po ng mga paborito nyong vegetables. Okay? Dahil K-pop naman po, nakikita nyo, naging idol nyo na po yung mga ibang artista po doon, kumakain sila ng gulay. Maybe you would try to take or eat yung mga kinakain na mga kimchi. And then, in our setting, in the Filipino setting, you also have to eat din po ano mga available vegetables and fruits po natin dito. Okay? And then slowly, you build those healthy food choices. You don't need to have an ideal plate. Pa-konti-konti, gumawa po kayo ng system or a program if you don't have the luxury of consulting right away with your doctor because of the COVID-19. But if you wanted to consult it, maybe online doctors available there to help you, it's pwede nyo naman itanong po sa mga inyong mga doctors po.
Ayan. Okay, so kailangan bantayan pa rin. No? You can go to these restaurants pero bantayan mo and be able to burn it as well later.
Yeah.
Ito naman, Doctor, related din sa pagkain. Pero this time, the question from Charlotte Hilahan is, how about eating less and being more active?
Okay, that is the old definition of weight management, no? So if if we are talking about the general population na walang sakit, walang mainiinom, and then perfectly normal, that is the key thing that, or the simplest message that we give to our patients. But if there's a health condition, it's easier said than done. No? We have to help them too. No, we don't force our patients to eat na puro gulay na isang tao ay puro karne ang kinakain. No? We have to somehow help them in trying to slowly move into a healthy continuum. No? And importante is support. Number one is support. Support from your friends, support from your family. Kasi kung isa po yung family niyo po na nangangantsaw po na, uy, taba-taba mo na, ganyan-ganyan. Siyempre, especially sa mga kids, I advise the parents listening na huwag niyo pong sasabihan po ng mga ganyan mga kids niyo, especially the teenagers. Kasi dinadamdam din po nila yan. And then there's a psychological effect or defense na baka nag-overeat din po yan. No? So do not tell those kind of terms. We are also careful with our terms or when we talk about obesity or overweight with our patients. We don't necessarily tell them na, oh, obese ka. No, we don't tell that. We tell them that excess yung timbang o medyo mataas ang timbang niyo po. Okay? So, um, yun yung mga kailangan nyo na pong tandaan din po. Okay?
Ayan. All right. Thank you, Doctor. And one last question, Doc,
Oh, sure.
from Ma'am
That's a good question.
Annalisa. Ma'am Annalisa Jamili. And I think this also could be a closing statement na rin regarding our topic. Successful tips on weight loss or maybe acquiring a healthy weight. Like, I mean, you talk to the viewers right now. I mean, there are parents also. May mga bata din, childhood obesity has been prevalent lately, o di ba, Doc? So,
Yeah.
how to successfully maintain or gain a healthy weight during these times?
First, you need to have a goal in your weight loss process. Not only weight loss, no. Very short term ang weight loss po. You won't be getting the success if your goal is weight loss. Your goal should be higher than that. It could be family, it could be healthy reasons, and then the next thing is start doing it. Start somewhere. It could be nutrition part, your diet. It could be your physical activity, your exercise. It could be your sleep. Could be work. No, yung parang you limit your task. So it is a multi level approach then po, no? And when you start that, make sure that you tell yourself that you can do it. No, if not, you could also seek a doctor for you to help you out. Not all the materials in the internet is reliable. You also need someone to help you, even your family, your friends, your healthcare provider, your doctor, to help you to get in your goal to be healthy. Okay, so start doing it. That is the simplest message that I can give to you.
Ayan, start doing it. No? Start now. The best time is now if you really want to gain a healthy weight. So not just during quarantine, but all the time. Tama,
That's
Doc,
right,
no?
Aga.
Mm-mm. Ayan. So with that, thank you so much, Dr. John Paolo Di Pasupil, for that very nice topic. You made this topic very much, clear to everyone. Naliwanagan kami on how to, on regarding the diet, you know, what food to eat, calories, intake, BMI, and of course the associated bad effects, especially to obesity. So thank you for this very timely and interesting discussion, Dr. John Paulo Di Pasupil.
Thank you to Aga for inviting me to speak this Sunday, and I hope Everyone have learned something. You just have to start somewhere and start doing it now.
Yeah, start somewhere and start doing it now because you can never out exercise a bad diet, 'di ba, Doc? So be careful of what you eat and be mindful of your weight, not just your weight, but your overall health.
That's right.
Yeah. All right. So once again, thank you everyone, especially to our live viewers. There are over 100 of them, and I'm pretty sure marami pa tayong mga kaibigan na gusto makapanood nito. So please share, continue sharing this Facebook Live to them so that they could also be able to learn about maintaining a healthy weight and all of these associated factors to obesity, and so that all of us will be healthy, di ba? So thank you so much again for joining us, especially from our to our doctors from different parts of the country. Maraming nagpapa-shoutout dito coming from our representatives from Zydus Philippines. So shout out daw sa mga kaibigan nating mga doktor, mga nurses sa Misamis, sa CDO, sa Cavite, sa Pangasinan, and many other parts of the country. Maraming salamat po for joining us today, doctors, nurses, everybody watching right now. Maraming salamat po. Yan. So this has been Aga Aison for your episode of Health Talk, how to maintain a healthy weight during quarantine. Thank you and have a great day.
Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.